Actually, my interest in medicine actually began as a child, funny enough. No one in the family went to medical school or actually went to college. I was the first of the grandchildren to go to college. And just always interested and fascinated with the human body and medicine in general. So logically involved in most of the occupations as Italians are in building things and doing tile and marble with my father. It became a logical progression once I went into medical school to do a specialty that involves the same type of tools, basically carpentry on the human body. My education was undergraduate at the University of Michigan at Dearborn, Wayne State University in Detroit for medical school. Residency training was at the Wayne State University Detroit Medical Center program in Detroit, Michigan. Spine surgical fellowship was combined with Louisville, Kentucky Spine Surgery, PSC, and in Detroit. This past year, in 2013, I was named Crittenton Hospital Physician of the Year, so I'm very proud of that. I mean, I think it's imperative that all surgeons stay up to date on new technologies. By the same token, though, it's been said you never want to be the first or the last to utilize a technology. So you have to make sure the technology is supported in the literature and that your patient selection is key. I think one of the most important parts of being a surgeon is having realistic expectations. Both expectations and the outcomes. It's important for us to educate our patients, and hopefully they have realistic expectations too. When those are in line, usually utilizes or yields good to excellent results. Well, at the LaMacchia Orthopaedic Institute, we have a state-of-the-art facility in regard to both preoperative physical therapy facilities and training, as well as postoperative. We really have a philosophy that believes in health and wellness, and in trying to prepare the patient for a surgery, we'd like to have them involved in a preoperative physiotherapy program. Obviously, you want to have all the muscles as strong as possible prior to an operative procedure, which there are some studies to show now that improves the healing process post-operatively. One of the reasons I chose spine surgery because for instance, a patient who has a disc herniation or a ruptured disc in their lower back, it's severe unrelenting pain. Basically, it feels like an electric shock from their butt cheek down to their foot. And again, after exhausting all those options, the treatment of choice is a microdiscectomy, where you actually make a small incision, remove some of the bone, and pull out that disc fragment. I mean, it's one of the most successful surgeries as far as rapid recovery for the patient. Immediately post-operatively, they have the surgical site pain, but the pain that's shooting down their leg or the electric shocks, they want to basically get off the stretcher and give you a big hug and say thank you, which most of them do, because the pain is pretty much reduced and gone immediately. As always, all options start with non-operative treatment modalities, including physical therapy, activity modifications, moving up to interventional injections, and then finally the surgical options when all those non-operative options fail and the patient's symptoms require further intervention. So at that point in time, it's really important that you take a step back, you slow things down a little bit, and I really pride myself in trying to explain things in terms that are simple to understand and make sense. Because again, having been through similar things myself, it's a scary situation to be in. And the last thing you want to do is scare the patient even further. You want to try to allay their fears and explain why and what needs to be done.